The shocking truth about addiction. How it hijacks the brain. Addiction is a complex and widespread problem that affects millions of people worldwide. It is a disease that not only impacts the individual struggling with it, but also their loved ones and the wider community. In this video, we will explore the science behind addiction and how it affects the brain. What is addiction? Addiction is defined as a chronic, relapsing disease characterized by compulsive drug seeking and use despite harmful consequences. It is a complex condition that is driven by multiple factors, including genetics, environment, and psychological and social factors. What happens in the brain during addiction? When an individual uses drugs or engages in other addictive behaviors, their brain is flooded with pleasurable chemicals, such as dopamine. This leads to feelings of euphoria and pleasure, and over time, the brain becomes wired to seek out these pleasurable experiences again and again. The repeated use of drugs or other addictive substances or behaviors leads to changes in the brain's structure and function. These changes affect the reward circuit in the brain, making it more difficult for the individual to resist the urge to engage in the addictive behavior. The brain becomes increasingly dependent on the drug or behavior to feel normal. And as a result, withdrawal symptoms occur when the individual tries to quit. What are the long-term effects of addiction on the brain? The long-term effects of addiction on the brain can be severe and lasting. Chronic drug use can lead to structural changes in the brain, including decreased gray matter and changes to the size and function of brain regions. These changes can impact a range of cognitive and behavioral processes, including memory, attention, and decision-making. In addition, addiction can also have a negative impact on mental health, increasing the risk of depression, anxiety, and other mental health disorders. It can also lead to changes in personality, such as impulsiveness, irritability, and antisocial behavior. What can be done to help individuals with addiction? Treatment for addiction is a crucial step towards recovery. It typically involves a combination of behavioral therapy, medication, and support from family and friends. Some of the most effective approaches to treating addiction include cognitive behavioral therapy, motivational interviewing, and medication-assisted treatment. In conclusion, addiction is a complex and debilitating disease that affects the brain and the individual struggling with it. Understanding the science behind addiction is essential for developing effective treatments and support for those in need. By working together, we can help individuals overcome addiction and build a better future for themselves and their loved ones.
Don't forget to like and subscribe to see more from Psychology Bits.